Hi everybody, welcome back to Dr. Shanté's Health Talks. As promised, I'm coming back with that short video talking about the profession of pharmacy. For those of you that want to explore it as a career option, I will be sure to put in the description box links to the new application. It's not new, it's been around for many years. It's just that I've been out of school over 15 years, that the application process is different. It's centralized, where you're uploading all of your information to a centralized site where you apply to different pharmacy schools throughout the country. So I only say that to say that I'm going to put those links for PharmCAS in the description box for you to go and get the information that you need to do as far as what it takes to get into pharmacy school, etc. I can only go off of my memory of what I did, and again, this is over 15 years ago, so it was quite a while. But I don't believe much has changed as I talk with newer graduates or newer pharmacy students. It wasn't required to have an undergraduate degree. They did want you to have 60 hours at least minimum of undergraduate studies. But here's the thing, in those 60 hours, you had to make sure that you had anatomy, physiology, general chemistry, organic chemistry, biochemistry, and physics. Those are some heavy science courses to take, and most of us tend to shy away from those courses. So they may have got you with just the 60 hours, and you go, "Ooh, that's it." But then when you look, they're like, "Oh, but you need this, you need this, you did this, you did this." So you almost are close to an undergraduate level degree, but before you apply, because of all of the heavy sciences that you have to take to get it. I remember when I first got it, they had just required physics. So the people before me didn't even need that year of physics. I'm like, dang, I have to take physics too. So yeah, all the memories. But anyway, so I don't think much has changed with that. We had to take the PhORCAS. Okay, that was the Pharmacy College Admission Test. And of course, it's a very competitive profession. When I applied back when to pharmacy school, I remember they told us that we had a pool of 600 to 700 applicants, but there was only 160 seats available in the class. And I don't know, I imagine that those class sizes are still very small. But there are more pharmacy colleges in the state of Illinois now than there were when I went to pharmacy school. So when I first went to school, there was just two, UIC and Midwestern, but now you have Chicago State, you have another UIC, Rockford. I want to say Roosevelt has a pharmacy school now. I want to say there's close to 6 of them now in the state, so it's a very heavily saturated market now with the opening of more pharmacy colleges in the state of Illinois. So I don't know, some of you may want to consider a state that doesn't have so many, and also job opportunities may be better retail wise if you go to a place where the market isn't as saturated. I would recommend a residency program after pharmacy school, so to be more in a clinical setting versus retail. Again, that's piling up so fast. I've had one long-term employer from majority of my pharmacy schooling and career up until maybe about a month ago, but it's been that one employer, and it's the retail setting. And I remember leaving pharmacy school, and they did not want us going to the chain pharmacies because you don't use a fraction of what you have to learn at pharmacy school when you go to the chains. You're not using it. They have all these computer systems and things and set for you to almost feel like you're on the conveyor belt. And then you give this impression to the public that your job or what you're doing is counting by fives, or you're there to press the button on a computer. That's not why you're there. That's not pharmacy. So I definitely wanted to make those type of distinctions. Pharmacy is not pharmaceutical. Okay, pharmaceutical pertains to companies. Okay, those are companies that manufacture drugs, certain types of drugs, maybe a lot of them, maybe even, right? Those are the Eli Lillys, the Pfizers, the AstraZenecas, right? Those are pharmaceutical companies. The profession of pharmacy is not pharmaceutical company, okay? So I want to make that distinction, okay? And I'll never forget my first day of pharmacy school. They had all of us in the auditorium, and they said to us, 160 bright-eyed, bushy-tailed first-year students that was ready to make a change in the world. And they said to us that drugs are poisons. And we were a little looking at each other like, what? But I get it now. Because what they wanted us to understand day one with what we were dealing with. Because what makes a drug safe and effective versus toxic is dosing, right? So you have to know those fine lines, and that's pretty much what it is that we had to learn in pharmacy school. We had to learn about the body, how the body functions normally, how the body is when it's in dysfunction, and then when you implement a drug, what it's doing to the body and what the body is doing to that drug. We had to learn how to diagnose, although legally we don't diagnose or prescribe, but and that's policy.